How to increase your chances of getting pregnant. Boost your odds of having a baby with these 10 tested tips. You will need a relaxation technique, optimal body fat, whole grains, plant-based protein, organic vegetables, full-fat dairy, daily exercise, folic acid, and acupuncture. Step 1. Learn a relaxation technique, like deep breathing or meditation, and practice it twice daily for 20 minutes. 54 women with fertility problems did just that for 10 weeks, and within a few months, a third of them were pregnant. Step 2. Determine your body fat percentage. Having too much or too little body fat can hinder conception. 20 to 25% is considered healthy, so if you fall out of that range, consult your doctor for a program to correct it through diet and exercise. Full-fat dairy like whole milk may increase a woman's chances of getting pregnant. Step 3. Favor foods that are believed to boost fertility, like whole grains over simple carbohydrates and plant-based proteins like beans and nuts rather than animal protein. Eat organic vegetables when possible. Pesticides can affect hormone balance, which in turn affects fertility. Step 4. Limit your alcohol consumption. According to a major Danish study, just 5 drinks a week lowers fertility rates in women. Also, you've no doubt heard this, but it bears repeating. Stop smoking. It lowers your odds of getting pregnant. It takes 2 to make a baby. Ask your guy to cut down on booze, and if he smokes, to quit the cigs. If he's taking steroids or bodybuilding supplements, he should stop those too. Step 5. Reduce your caffeine intake, or consider eliminating it altogether. The jury is still out, but some studies suggest that high caffeine intake reduces female fertility. Step 6. Don't use an electric blanket, which has been associated with a risk of miscarriage in the first month of pregnancy. Step 7. Exert yourself for at least 30 minutes every day. Research shows that daily exercise can help women conceive, possibly by making hormone levels more conducive to procreation. Step 8. Many doctors advise pregnant women to take folic acid to prevent birth defects. But research shows that the supplement can help them conceive too. In one study, women who took a daily multivitamin that contained folic acid had a 40% lower risk of ovulation problems than those who did not. Step 9. Limit your use of over-the-counter pain medications, which can interfere with ovulation. Step 10. If you are trying in vitro fertilization, go for acupuncture. 2 studies show it boosts IVF success rates. Step 11. Have lots of sex in the winter, when sperm counts are higher. Did you know? 1/3 of fertility problems can be attributed to women, another third related to men, and the remaining third are due to either a combination of both partners or an unknown cause.
How to know if you're pregnant. There are signs you're having a baby even before you miss a period. You will need a knowledge of physical symptoms, a home pregnancy kit, and access to a clinic or doctor's office. Step 1. Pay attention to your body. Symptoms like fatigue, swollen or tender breasts, and nausea can show up as early as 2 weeks after conception. Headaches and lower back pain are also early signs. Step 2. Consider whether you've been more emotional lately. Some women find that pregnancy makes them moodier, weepier, or more irritable than usual thanks to the hormonal surge that occurs after conception. Stress can cause hormones to mimic pregnancy signs like nausea. It can even cause you to miss a period. Step 3. Take a home pregnancy test. It can sometimes detect pregnancy even before you've missed your first period. Be aware, however, that taking it early may cause a false negative result. For the most accurate results, take the test in the morning when pregnancy hormone levels in urine are highest. Step 4. If the home test is positive, see your doctor right away. If it's negative and your period still doesn't start, then repeat the test in a few days. False negatives are more common than false positives. Step 5. If you get your period, don't assume you're not pregnant. If it's unusually light, it may be what's known as implantation bleeding, which happens when the embryo attaches to the uterus. Step 6. To be absolutely sure, go to your doctor for a blood test. Because pregnancy hormones are easier to detect in blood than urine, blood tests are more accurate than home kits. Did you know? The most common oddball food combination craving during pregnancy is pickles and peanut butter, followed by Marmite and ice cream and tuna and bananas, according to an online poll.
How to choose a sperm donor. Tall, dark, and handsome is nice, but there are more important things to look for when choosing half the genetic makeup of your child. These guidelines will help. You will need a donor or reputable sperm bank, state law regarding known donors, and careful consideration. Optional, a legal contract. Step 1. Decide whether to enlist someone you know to donate sperm or use an anonymous donor. The former is cheaper and has a better success rate because known donors can contribute fresh sperm instead of frozen. But some women prefer sperm bank donors because they have no legal rights to the children they father. Step 2. If you're leaning toward choosing a stranger, consider how anonymous you want the transaction to be. Some sperm banks offer identity release donors, also known as open donors, men who are willing to be contacted by their offspring after the children turn 18. Step 3. If you decide to ask a friend to donate sperm, thoroughly research the pertinent laws. Their rights and obligations vary from state to state. Have an attorney draw up a contract that addresses custody, financial support, and visitation. Be aware that if you live in a state with parental rights laws that contradict your contract, the state may not honor it. Step 4. If you go with a sperm bank, check out a few before deciding on one. Things to consider include live birth data, their policy regarding donor privacy if a child develops a medical problem, and any limits on how many children a sperm donor can father. See if the bank is a member of the Better Business Bureau and check for opinions and reviews online. Step 5. Review donor profiles, which include the person's height, weight, ethnicity, religion, blood type, and education. A photo and even an audio interview is sometimes provided. Sperm donors also fill out lengthy questionnaires that provide potential parents with insight into their personality and character. Step 6. If you choose an anonymous donor, stock up on his sperm if you think you might want another child who is a full sibling. Good luck! Did you know? At one California sperm bank, would-be parents can be matched with a sperm donor who looks like a celebrity they'd like their child to resemble.
How to boost your odds of conceiving twins. Identical twins are the luck of the draw, but you can increase your chances of having fraternal twins without fertility treatments. You will need dairy products, yams, body fat, and multiple pregnancies. Talk to your doctor before embarking on any regimen to conceive twins. Step 1. Eat dairy products on a regular basis. Research indicates that women who do may be up to 5 times more likely to have twins than vegans. And chow down on yams. They contain a chemical that may cause women to produce multiple eggs, which may be why twin rates are higher in some places where yams are a dietary staple. Step 2. Consider gaining weight if you're underweight or normal weight. Women who have a body mass index of 30 and above have a better chance of having twins. But you better go on a diet after you give birth. 18.5 to 24.9 is considered a healthy BMI. Step 3. Get pregnant. Again and again. Your odds of conceiving twins increase with each pregnancy. Step 4. Try to get pregnant when you're over 35. Older women have higher rates of multiple births, but don't intentionally delay having any children at all until then, or you could end up childless. Fertility decreases dramatically with age. It's possible, though not likely, to conceive naturally until about age 50. Step 5. If you've been taking birth control pills, do your best to get pregnant during your first cycle off the pill. Women who do may have a slightly higher chance of conceiving twins. Did you know one study found that women who gave birth to more than one baby at a time averaged an inch taller than the mean height of U.S. women?
How to choose an egg donor. Having a baby with the help of an egg donor is expensive, so make sure you know what you're doing from the start. You will need a reputable agency, donor profiles, and careful consideration. Step 1. Decide whether you want to ask someone you know to donate an egg or use an egg donation agency. Though the former can be cheaper and easier, the latter is largely free of emotional complications. Step 2. If you decide to ask a friend to donate her eggs, thoroughly research the pertinent laws. Their rights and obligations vary from state to state. Have an attorney draw up a contract that addresses custody and visitation. Step 3. If you decide on an egg donor agency, find a reputable program. Ask your fertility specialist for recommendations, and check out online reviews of agencies in your area. Look for companies that are endorsed by nonprofit infertility organizations. Be leery of any agency that asks for an advance lump sum payment for their services. Step 4. Think about whether you'd like a totally anonymous egg donor, a semi-open donation where you and the donor agree to chat by phone or email, or an open donation where you and the donor know everything about each other and can decide what contact the donor and child will have in the future, if any. Step 5. Review donor profiles, which provide the person's medical history and vital statistics. Photos are sometimes included. Donors also complete an extensive questionnaire that provides clues to their personality. If the agency conducted psychological testing, consider having a mental health professional evaluate the results. To keep things impersonal, choose a separate egg donor and gestational surrogate. Step 6. Be realistic. Buying the eggs of someone with certain genetic traits doesn't guarantee that your child will inherit them. How you raise them is what will truly define them as a person. Did you know? One expert has estimated that 90% of women seeking to become egg donors never make it past the initial screening.